Welcome to For the Health of It, an intimate look at public health in Cowley County, Kansas. Join us as we discuss topics that are impacting public health in our community and learn about what we do at your local health department. Hello again, everybody, and welcome to another edition of For the Health of It, Cowley County, an in-depth look at all things public health in Cowley County, Kansas. This is Tom Langer, the Administrator and Public Health Officer at the City-Cowley County Health Department. And with me today, as normal, is my Assistant Administrator, Allie. How are you?
I am doing well.
Good. We're going to take a long, hard look today at everything that was 2024. It's hard to believe that we're already a month into the 2025 year, but part of the responsibilities that we have to our community and everybody that wants to know is to put in writing a report each year about what happened in the previous year. It's our annual report, and it's ready for publication, and it's on our website, and it's live. But today we thought we'd go through that with you on the podcast, kind of explain in detail some of the things that are in there, and then invite everybody that listens to take a few minutes, open it up, take a peek, and learn a little bit more about all the things that we've done during 2024. I thought it was a pretty decent year from the public health perspective. What about you?
I definitely agree.
Okay. You know, you and Daniel both do just a knockout job. For those of you that don't know, I'm talking about Daniel Vildesal. He is the silent Dan behind the mics, but he works really hard on formatting and compiling all of the information that we just kind of take and shove on his desk and say, here, put this in the annual report. And then that thing that we have at the end is a work of beauty. So you want to take it away from here because you know a lot more about how this was put together and what's in it. And I will just, of course, make my comments from the peanut gallery.
Sure. Okay, so this annual report is, of course, as Tom mentioned, a summary of activities accomplished by the health department in the year 2024. Our front cover, I think that this is a nice story. It always features a photo that was taken in Cowley County. We host a World Photography Contest every August, where we ask community members to go ahead and submit photos to us that they have taken that they think are special. So we receive all kinds of different photos of landscapes and different things like that. And then we select a winner. And then one of the perks of being the winner each year is that photo is then featured on the cover of our annual report.
Allie, when we talk about the photos, there is a caveat. The photos have to be of scenes or things that are specific to Cowley.
Right, in Cowley County.
Yeah, to Cowley County. It's just so people know. It's not just any picture, because there are a lot of great pictures, but we look for the local folks who are taking pictures when they're out and about. And this one, talk about it. For a person who cannot see it, kind of describe what the winning picture was.
Well, this photo was submitted to us by Thomas Carver, and it is a night scene, which I think is interesting because it was the first submission that we have ever received that is a photo of anything in the night. And this is a photo that is overhead in Arc City, and it is a photo of the light parade.
For Arcolala. And
yes.
It really is cool. It's a nicely put together photo, and we were glad to use it. Adds a unique flair, I think, to the annual report. Okay.
And then, of course, Daniel and his design creation always works intentionally to make sure that our theme throughout the report is consistent with the winning photo. So, Tom, you want to go ahead and kind of explain the theme we have going on here?
Well, when I saw it, Daniel presents two or three, or multiple formats and says, "What do you guys think?" And this one just kind of jumped off the page. I know last year we had one that was kind of like road signs, and this one for 2024 was different. It kind of was like an early 60s modern theme, I would call it. And when I looked at it, being a baby boomer, it made me almost automatically think of the Jetsons cartoon that I used to watch when I was a kid. And when you look at it, you will see it because it has those little starbursts, and it looks kind of futuristic, like something that would have been high tech in the early 60s. And so as I penned the letter to the community that I do each year, just a short little blurb about I talked about the visual theme, and then I also tied it back into how I recalled as a kid seeing all those things on cartoons and the sci-fi shows of the day. It's amazing how many of those things that were portrayed back then have come to pass. like our smartphones and the way we communicate and all that kind of good stuff. So anyway, it made me think a little bit more about, boy, if that's what's happened in my lifetime, what's going to happen in the next 20, 30 years as technology continues to twirl, and how will it affect us in public health? So pick it up, give this a read. It's kind of cool.
Okay, and on page 2, we have a brief summary of who we are as a health department, some services we offer, and then also who we provide service to. The year 2024 was our 78th year of service since our inception in 1946, and we feature over 30 different health and wellness services to make sure that everybody is able to stay well.
It's a lot. People don't realize, I think, the depth of things that we do and the variety. So this is a really good representation showing how broad-based the things that we do. The 7 core programs: immunizations, women and infants, maternal and child health, reproductive health, environmental health, emergency preparedness, which I think is highly underrated, but that people never think about, and then, of course, child care licensing.
In 2024, the youngest client that we saw was 5 days old, and the oldest that we saw was 102 years old, with an average client age of 20 years old.
Yeah, I think that's a wonderful representation showing, in fact, exactly how we are here for the entirety of an individual's lifespan.
So I encourage you to go ahead and take a look at this on our website. But for you, those of you who are just listening, there's a timeline here, and it starts with a woman who is pregnant, and then we have an infant and a child, and the child ages, and they're in their teenage years, and then they're adults, and then there are new children, and then there are some old people, really to show that we do provide service through every stage of life.
I'm getting to feel a little bit scared now because I'm closer to the end than I am to the beginning.
I think I'm right in the middle.
Yeah,
so.
There you go.
In 2024, we saw 13,738 distinct clients. What that means is that was unique individuals. So we saw them each at least one time. Throughout the year, we had 2,742 new clients to the health department. And in October alone, we had 551 new clients just in that month. That is a record for the health department in a single month.
That 13,000 plus number is significant too when you consider Cowley County. Our population is just right around 35,000 people. I mean, that is what, 30%?
It's actually just over 40. We have a little deal here that says 2 out of 5 Cowley County residents received a health department service at least once.
Which I like to see because that's verification that we are, in fact, serving the community and the people in Cowley County.
Okay, and then in the annual report, we start getting into those 7 core programs that Tom had mentioned. And the first that we have listed is immunizations. In the year 2024, we gave a lot of different immunizations, wouldn't you say?
Yeah. When we talk immunizations, we're talking the entire spectrum again, too. And we know that there are basically 2 major categories. One are those that are for childhood diseases, or the human diseases that we would have contracted as children. And then we have those vaccines and immunizations that are available once you are an adult. And they are different, but they're similar because they are designed, of course, to be a primary preventive prophylactic for disease. That is why we give them, but they're different because there are some things that we don't provide to children that we only provide to adults and vice versa.
Absolutely. And I think it's important to say, too, that we do offer some of the travel immunizations that are offered if you need to go overseas, depending on where you're going. But there aren't many places in the area that actually offer the typhoid and yellow fever vaccine. So I think that's really cool. We have people who actually come over from Oklahoma sometimes to get those things before their travels.
Yeah, we're the closest one in the area.
And then we have a line graph here that shows the distribution of how those doses were administered throughout the year. And in the first half of the year, we're hanging out around 500 doses a month. And then we get into the back to school season and we hit that heavy October month where we're really focused on respiratory season. And we had over 2,000 doses administered in that month. So that does make sense that maybe we did have 551 new clients that month.
And it is because, when you take a look at what we do, 500 vaccinations of all types on average per month, that's a lot of vaccine.
And I think this is really cool. Our director of nursing and her team, they actually went off-site from our 2 office locations to a different location in Cowley County to administer immunizations at different events within the schools, long-term care facilities, all kinds of places, 49 times.
If you're a community resident, you're probably familiar with the two big items that we do every year, which are our drive-through flu shot clinics. Those are big. We're looking to find out how can we continue to expand our services to get out where people are, especially when we have populations that perhaps are impaired for travel. They don't have cars anymore, they're elderly. So we'll go out to the sites where they're at. We'll go to them rather than have to make them come to us. Talk about WIC.
Yes, this is our second of the core programs that we have included in our annual report. And this program is extremely important and provides service to lots of people in the county.
The Women and Infant Children program, just if you don't know, if you've never been part of it, it is sponsored by the United States Department of Agriculture, the USDA, and it is a nutritional supplemental program. What does that mean exactly? That means that if a woman becomes pregnant, from the time that she is diagnosed as being pregnant or discovers she's pregnant, through the pregnancy, she is provided some additional assistance so that she can have a good, healthy diet, nutritional assistance. And then we also have that for the newborn child and a child up to age 5. So this is a program that helps get our littles from before they're born right up through age 5, making sure they have a good start in life because of the fact that they have good nutrition.
Yes, and this program is really special because it works with families to provide education on several different challenges that I think a lot of families face. The appointments are very, very specific for whatever the family is encountering at that time. That can maybe be that the child just turned 6 months old and is going to start having solid foods, or maybe they're having a tough time getting rid of that pacifier. This program helps provide strategies to help with some of those things.
Talk about what it does to the community.
First, I would like to say that for the community, in 2024, there were 246 infants that were a part of this program. And I think that that's a really special number when you're considering that in Cowley County each year, there are approximately 400 new babies that are born to residents. So if we are seeing over 50% of them in this program alone, I think that that's very special.
That's significant, absolutely significant.
Our average monthly participation for this program was just over 1,000 participants, and that means that there were 1,000 participants who actually went and expended their benefits in one of our local stores.
Yeah, active participants every month.
Those stores include Dillon's in Ark City and Winfield and Walmart in Ark City and Winfield.
They're the grocery stores that are enrolled in the WIC program at the state level. And what that means is they accept the little debit card that the benefits are loaded on. For people that don't know, the benefits are for food items specifically.
Yes.
Fruits, vegetables, milk, eggs, those types of things. It's not cigarettes, beer, or things like that. No. These are specifically designed to meet the nutritional requirements of the individuals, and that's why when they meet with our nursing staff and with our registered dietitians, those things are discussed, and those plans are put in place for them and their children, and that's what it is. And they get the benefits for, like fresh fruit and all that, so that they can purchase those things at the stores.
Speaking of purchasing things at the store, it looks like there was quite a bit of that going on in 2024. In fact, throughout the entire year, there was over $885,000 that was expended right here in Cowley County at these 4 WIC eligible stores.
That's on groceries. That is food, and almost 600,000 of that was down in Ark City.
Yes. And when you go ahead and download the annual report or take a look at it on our website, you can see a distribution of how those dollars were spent by month and in each store.
That's money spent in our local economy, which is really impressive.
Yes. And one thing I think, too, that's very cool about that is that $885,000 mark is actually over $100,000 more dollars compared to our 2023 expenditures. Coming up in the WIC program in 2025, we're going to be hosting several different classes with topics to help families, again, with some of those challenges that they may face. But I think one thing that's really cool about that is that our participants actually voted on those topics. So we're going to be, again, offering those classes in March. And I think that that'll be a good time for our families to interact with other families and also just learn a little bit more about ways that they can improve their households.
Yeah, their health. I mean, that's really what all this is about. I mean, it's common sense things that people can do that empower them to take better care of themselves, to live healthier lives, to make sure that they are providing for their kids, and their families.
I think that that's a really nice transition into our third core program, and that is the Maternal and Child Health Program.
MCH, yipper dipper.
This program is really special. It offers a wide variety of services, and these services are available to all families who are expecting a child or who have had a child in the last 12 months. And these services are offered at no out-of-pocket cost.
Yeah, and we don't care where you're at. You can have a lot of money, you can have none. This program is designed to help moms, because even the most put together, well prepared person is going to have time when they're raising family, when it just becomes too much. And they're going to be at their wits' end, and they're going to need some help. And that's what this program is really all about. If you're a first-time mommy, or first-time parents, I should say that because dads are involved in this too, we provide assistance. We've got folks that this is what we do. We handle these types of questions and comments and crises. 249 babies, 249 babies that we see, new ones each year. And when you consider that every year until they're 5, what's that gonna work out to? Allie,
They were
that's
over 1,000.
about 1,250,
Yeah.
about 1,250 babies that we'll see every year. Or little ones, and it's kind of interesting to see how they come in and how they grow, and we really develop a relationship with a lot of you because we watch you as you're growing as parents, and we watch your kids as they're growing up, and it's really a unique thing in our community. So it's a great program.
And I just have to tell the people who are listening that on this MCH page, in the annual report, that's page 5, there are some really sweet photos.
Of little kids in our community. Health department babies, I guess you could call them.
Yeah. Okay, so on page 6, we are going into our next core program, and that is the reproductive health program.
Yeah, good old reproductive health. Now, what is that exactly? Well, this program covers the gamut of things that involve human sexuality, from the time people become sexually active to the hazards they may face, like STIs, STDs, pregnancies, and all of that good stuff, and how we can assist individuals as they navigate that portion of their life. So this is getting up to adolescents, young adults, where these services are provided. We have some really interesting charts and graphs in the annual report that kind of show services by age, by gender, and all that good stuff. Allie, take it away.
In 2024, we had 281 participants in this program. 243 of them were female and 38 of them male.
Now that's kind of interesting. We need more guys to come in and get checked because that numbers, just those numbers to me just don't seem quite right. But we're pushing for that. Guys, if you're listening, there's nothing wrong with coming into the health department periodically and making sure that you're okay. Do it.
On this page, we have a breakdown of age categories that our clients were at the time of their service, all the way from less than 18 years old to greater than 44 years, with most of them being in that 18 to 34 age range.
Busiest month for client visits in this seems to be that June, July, August area?
Yes.
Yeah. Any idea why that might be? What I know we've talked about this.
Around this time, we actually see a lot of college students. We'll see our local college students who are coming in maybe before they leave the county to go to school, but then we'll also see some of our first-time clients that'll come in Cowley County. So we'll be connecting with them.
And establishing places where they can get care and all of that good stuff. Talk about the dreaded sexually transmitted infections a little bit.
Well, in the year, we did 802 STI tests. And then if you're looking at this report on page 6, you can see a pie chart of kind of how that breaks down. But we did test for HIV, hepatitis C antibody tests, chlamydia, gonorrhea, and syphilis.
We presented this report to our Board of Health, and one of the things I always look back, because I'm kind of a history buff, I look back at our founding documents from the 40s. And, one of the reasons that the health department came into existence was because of this core issue. This is something that's been around, I think, since, man has walked on earth. It's going to be here until we're all gone. But these are issues that, we know how to take care of now, but we're still seeing it year in and year out that there is a need for this type of a program and activities. Talk about contraception as well.
Well, we offered a lot of it throughout the year. We gave out over 3,500 condoms, 237 pill packs. Those are the 1 month supplies. We did 324 of the depot injections. That's typically known as the shot. We gave out 11 Nuva rings and then 9 Nexplanons.
And that Nexplanon is the long-term reversible birth control method where it's an implantation, not of an IUD, but it's subdermal, isn't it?
Yes, and it goes in the upper arm.
Yeah, the upper arm. But it's something that you only have to have
every 3 years.
Every 3 years? Okay. Since I don't have one, I am not.
I'm happy to hear that. I don't believe they did testing. I don't believe they did testing on your cohort. This program also provided 210 pregnancy tests and 42 well woman exams.
Right. One thing I do want to talk about as far as reproductive health services go, that is exactly what it is. It's how we help individuals prepare for being healthy as they plan a family. The health department never has and never will be associated with any type of abortion services. I think that's important that people understand that, because sometimes they'll hear those terms and they'll dump it all together. The health department is all about life. We're not about abortion.
And this program offers services on a sliding scale fee based on income, and all services are provided confidentially regardless of age. The next program we have within our report is the environmental health program. I think that you know a few things about this, Tom.
A couple or so. Yeah.
Go ahead and tell us about this program.
The environmental health program basically is how we interact with our community in the county, especially where wastewater, on-site, and well water is concerned. So in Cowley County, we have municipalities, of course, like Winfield, Ark City, Udall, some of the ones that actually have a public sewer system where houses in the cities are connected to that, and they go to municipal wastewater sites, and they have municipal drinking water deals where it's piped to our home. But we have a lot of residences in our county that do not have those types of services extended to them. So in order for them to live, they have to have a source of drinking water, which is generally through a drilled well, and then of course a wastewater system, which will either be a surface lagoon, wastewater lagoon, or a subsurface septic system. How those things are designed, how they are installed, how they operate, believe it or not, that is all part of the health department realm, because we have the expertise to go out and help folks design those things. We inspect them. We are concerned about water safety and water pollution, especially where human use and human waste is concerned. So those numbers that you'll see in there for inspections and permits and screenings, it just kind of goes to show you what we do on an annual basis. And I'll tell you what, it's been busy. Animal bites. Oh, yeah. We also chart animal bites. This is one of those things that Silent Dan does for me behind the scenes. He tracks all of this. We get reports of animal bites from all over the county. Most of them are coming from local law enforcement jurisdictions who have animal control officers. We monitor the number of animal bites because we're always looking for one thing, and that's any possible threat of rabies to humans. And those generally would occur through animal bites. The one thing is, a lot of them, I think the vast majority are domestic animals. Local dogs, cats, and people that just don't keep them up on their vaccinations.
And then we transition into our next program, the emergency preparedness program.
This probably is one of the areas that I have the greatest, I don't want to say love for it, but I have a real passion for this because of the fact that I've mentioned in other podcasts, part of the role of what we do at the health department is have to sit down and think about the absolute worst day we could ever have in the county. And what does that mean? Well, take a look around at the world that we've seen right now, Allie. Just within the last few months, we've seen violent storms. Hurricanes lash the coast, move inland,
Fires.
leave people homeless, destroy the countryside. We've seen fires. We've seen plane crashes. Right.
Right.
All of these things, they are all either man-made or natural disasters that affect human life and human health. We live in a part of the world where every year we set our planet on fire around us, to burn off old grasses so that we can help, save the prairies and what have you. But we also live in an area where on any given day we could have a severe atmospheric storm. We could have ice storms. We could have flooding. We can have tornadoes. We can have things that will, in the blink of an eye, literally annihilate a community, or in the worst case scenario, erase part of it or all of it from the map. And how do we react? How are we prepared? How do we respond when those things, so that we can survive and recover? That's what preparedness is all about. So when you see through the course of the year, our public health notices coming out to you, and Daniel does this quite a bit. We've got, I think September is our preparedness month, if I remember right. We talk about this a lot, and it's not just because we got nothing better to do. We really do want folks to think about this at a personal level and how they would prepare. So take a look at these little snippets that we've put in there, because while you never want us to have to exercise one of these plans, I want you to understand and feel confident that we do have those plans, so that when something bad would happen, we can be there to assist and help and keep things organized in a fashion that will allow our community to recover quicker. Oh, lead poisoning. You just snuck that one up. That's on page 10. That's another one of those things. Come on, you know a lot about this. You've been working on this. Why don't you talk about lead poisoning prevention?
Well, I think that this page is a great start. We do a lot of testing.
Lead poisoning prevention is an area that we are absolutely devoted to and focused on, because we've talked about this in the past. I think, if I recall, we had topics about this in podcasts. Mm-hmm. We are still battling issues in our children, in babies and little kids, from mistakes that were made in our community over 100 years ago. And it was mistakes that weren't done intentionally, I hope, but it was because of the fact that the state of the art at that time was to use lead in all kinds of products, including paints and surface coatings and everything else. And they're still around, and they are still a deadly neurotoxin, and we are dealing with it, and we continue to see it. It is 2025, and we are seeing kids who live in houses that were built in the early 1900s, and they are being poisoned by the things that happened in those houses back in those days. So this is a representation of what it does, what it means, what we do, and I would love for people to look at this and become a bit more aware of the risks that you face on a day-to-day level, regardless of income, regardless of where you live. If you live in Cowley County at all, your kids are at risk for lead poisoning. And so it's something that we want you to be aware of, and it's something that we take very seriously.
It's important to note that there is no safe level of lead in the blood, and we have that notated here on this page. There's also a nice, what would you call this, Tom, here?
It's a gradient, or
okay.
It's when we talk about what's normal and what's not, and why you should be, it's like a dashboard, or like a...
Sure. So we're starting green, and then as we move up, we're red.
Yeah.
And it's talking about what the different levels might mean of lead in blood. And in 2024, the highest confirmed level through venous blood testing was 34.8.
That's pretty high.
And for reference, we would really like for kiddos to, of course, have no lead in their blood, but that normal range is 0 to 3.3 micrograms per deciliter.
And that's a minute amount. It really is. A microgram per deciliter is like 1 grain of sugar in 2 liters of water.
Yeah. In Cowley County, and not just the health department, but what would you say, Tom? Probably 85% of testing, maybe 90%.
Yeah.
is done here at the health department.
I'd say we probably do 85 to 90%.
Right.
Yeah.
There was around 1,000 tests that were done throughout the year at different places. On this page, you can take a peek and you can see a breakdown of where those individuals lived by zip code at the time that they were tested.
Moms, Dad, understand one thing. When your littles come in and we ask to do this, and we take, I know it makes them cry a little bit because we give a little poke to a finger and we collect a couple of drops of blood in a little pipette for us to run the analysis on. That is such a instrumental screening that we do. Lets us know exactly what risks we're looking at with that child. And you don't want them to have developmental delays or physical abnormalities that might arise because of the fact that when they were little, they suffered from what we call lead intoxication. So bear with us on this. We want you to understand it. We will be absolutely open with you. We will explain it and explain it and explain it. And hopefully you guys will embrace it and help us help you keep your kids safe.
That's a pretty great transition to the last of our 7 core programs, I'd say, child care facility licensing.
This is a state requirement. So in Cowley County, we've often talked about there's not enough. We don't have enough, daycare facilities in our county. But the ones that are here, they have to meet certain standards, not that we set at the county level, but that the state does. And we do that work because it's important for us to have somebody local work with other local people. So that's a program you don't hear much about unless, of course, you have kids and you're looking for childcare.
The next page in our annual report features our communication methods. In 2024, we definitely increased our presence on the air. We supported our health department podcast that you are hearing now, but we were in season 2 last year, and we also had volume 3 of our biweekly publication of the Public Health Update.
Mm-hmm. It's a great little newsletter that Daniel publishes. Always go out and listen to the podcasts. They're out there. They're archived, so you can listen to them from the very time we began till now. The topics don't change, but sometimes the content will from time to time. And what else we got going on?
Well, the next page talks about different things that we did in the community. And one of those things is that in the middle of the year, in July, we had several staff that were actually trained to conduct presumptive eligibility screenings.
Okay, what is that exactly?
These are just a really quick screening of an individual, their household income, some of their different health considerations to see if they might qualify for state Medicaid.
Okay, which is can care. You hear a lot in the news about can care. This is when we have a kiddo that would come in whose folks don't have insurance.
Or a pregnant woman, or just really anybody without health insurance.
Right. So that we can get that basic health insurance coverage for them. We do the screenings. If they meet the requirements, they are presumed eligible, and hence the term presumptive eligibility, right?
Yes, and that means that they, at that point, would receive temporary coverage that very day, and they can go ahead and use that to receive whatever care that they need.
Right, so if they need a vaccination or they have to have a checkup, those things are available to them.
The next item on this page is the Health and Safety Fair, and this is a major event that's put on for the community each year that Daniel organizes for the community. Last year, there were over 400 attendees at our Arc City Fair, and there were over 50 participating vendors with booths and activities and all sorts of different things.
Yeah, this year it's coming up again in...
yes, it's going to be on May 17th.
Okay, May 17th. It's going to be in Winfield. This time it's Winfield's turn to host. So mark your calendars. Make sure you come out and see that.
And then the final thing that we have on this page is a brief summary of the work that we did with other community partners to host the Community Health Needs Assessment that's performed every 3 years in Cowley County. This methodology is to recruit local residents to kind of tell us what's going on in the community, tell us what they think about health opportunities, needs, wants, that type of thing. But we really focused on surveying households last year, and so we were looking at one survey per household, and we collected 2,451 of those surveys, meaning that 17.5% of Cowley County households were surveyed.
That's very significant. There isn't another community in the state that could boast those kinds of numbers. To get a 17% population response to a survey is phenomenal.
the next phase of that in 2025 is we're going to be taking that data, everything that we had learned, to craft a community health improvement plan. And that plan is going to focus on a few core areas like housing, food and nutrition, healthcare access, transportation, but looking at those things and discussing and identifying strategies to make progress in those areas.
I think we've gone on for almost 40 minutes nonstop talking about things that we did last year.
Yes.
And we could probably continue to go on. When you go into the annual report, you see the final few pages. You're just going to see some summary information. You're going to see, what did we do? Where did the money come from? How is it spent? All of that. Who are the members of our Board of Health and the members of our staff? And then basically a thank you for allowing us to continue to serve you in the community, and a reminder of what our mission is, which of course is, providing you the opportunities to learn a little bit more and to take care of your families, because that tagline we have, that is part of what we say on every ad and everything else, is we work hard every day to help you stay well. That is really kind of the summation of what this is all about and the efforts that we put forth in the year 2024. So all of our annual reports are on our website. Go out and visit it. You just type Cowley County Health Department in a Google search, and it'll take you to our site. You go in through the actual county webpage. Even though we're not a county department, they allow a space on theirs, and so that really works out well. And you'll find annual report under the Board of Health tab, or actually right now I do believe on our homepage, one of the first things you'll come to is a picture of the cover of the annual report, where you can click on that and it will take you directly to the online version. Have I missed anything? Have we left anything out?
Oh, certainly, but
I'm
I think
sure.
that's a good
It's a good
way to wrap up
place
today.
This is. We hope we didn't bore you to tears. There's a lot of stuff out there, and we can get into the weeds on a lot of these things, because it's amazing how many things we do. And the other thing is, you can go out and take a look all the way back. I think we have all the way to 15.
Back.
Goodness gracious! I wonder who came here in 2015 and started putting this stuff on the website. Well, anyway, we won't talk about that. 10 years worth of annual reports, and you can see each year we continue to do better and better and get bigger and stronger to help you guys stay well. And that brings us to the conclusion of this podcast. What are we going to talk about in the future? Well, all kinds of good things are coming up. I know we're going to have more to share with you about what we call the CHIP, the Community Health Improvement Plan, which is currently being fashioned, which is information pulled out. In other words, what are we going to do in the next 3 years to solve some of the issues or to address some of the problems that we know we've got? We're going to be really excited about sharing with you some of the neat things that are going to be happening at this year's Health and Safety Fair, which, it's February now, and it's going to be May before we know it, and all of the good things that happen in between. So lots going on, lots that we have to do on a day-to-day basis. We wouldn't do it if we didn't have you, and we thank you very much for tuning in and listening to For the Health of it, Cowley County. And so till next time,
Stay well.
Stay well. Thank you for joining us for this edition of For the Health of it, Cowley County. We hope you found it useful and that you'll tell your friends and give us a listen again during future episodes. As always, we end today's segment by replaying a recent Public Health Minute, which is a weekly radio message focused on keeping you healthy. So, until next time, stay well, everyone. February is National Heart Month, so here's your health department with some tips to help you stay heart healthy. First, eat a balanced and nutritious diet. Salty foods packed with saturated fat increase your risk of heart disease and other problems. So, instead, go for fresh fruits, leafy greens, and whole grains. And don't forget the fish. These all contain nutrients that can protect and keep your heart in good shape. Next, get some exercise. Regular exercise lowers your risk of heart attack and strengthens your heart and cardiovascular system. Plus, it can also help you maintain a healthy weight. Lastly, make sure you're getting regular care by examining your risk factors such as blood pressure, cholesterol levels, and blood glucose. Your doctor can help you manage your heart and make changes that are necessary to stay healthy. Remember, the earlier a problem is detected, the sooner treatment can begin. And helping you stay heart healthy, well, it's just another way the health department works hard every day to help you stay well.